Now that you got to what inflammation is and what are the types of inflammation, let me help you differentiate between the two, the acute inflammation and the chronic one. Though we have already discussed it in acute inflammation, but as the topic demands, so I won't bother repeating it here for you. Well, starting off, acute inflammation typically lasts only a few days, but do remember that it has a rapid onset. While, in contrast, the chronic inflammation lasts weeks, months, years, or even indefinite period of time, and typically has slowed or delayed onset. In case of acute inflammation, on the release of inflammatory mediators, inflammatory cells mobilize to the area of infection or injury, and by certain mechanisms, they manage to resolve the problem or heal the tissue. And this is the reason behind calling it good inflammation. Whereas in chronic inflammation, the inflammation becomes the problem, rather than the solution to infection, injury, or disease. It causes continuous tissue damage that can even lead to organs failure. So, it justifies being called as the bad inflammation. Furthermore, acute inflammation is usually a response to sudden body damage. So it might result from exposure to a substance, such as a bee sting or dust, an injury, or an infection. While the causes for chronic inflammation are quite different, it can be due to an untreated causes of acute inflammation, like an infectious organism, including Mycobacterium tuberculosis, protozoa, fungi, and other parasites that can resist host defenses and remain in the tissue for an extended period. Also, the exposure to a low level of a particular irritant or foreign material that cannot be eliminated by enzymatic breakdown or phagocytosis in the body, including substances or industrial chemicals that can be inhaled over a long period, like silica dust. Another cause can be an autoimmune disorder, which involves immune system mistakenly attacking healthy tissue, giving rise to diseases such as rheumatoid arthritis and systemic lupus erythematosus, or SLE. Moreover, there might be a defect in the cells responsible for mediating inflammation, leading to persistent or recurrent inflammation, such as autoinflammatory disorders, like familial Mediterranean fever. Also, the recurrent episodes of acute inflammation can be an underlying cause. However, in some cases, chronic inflammation is an independent response and not a sequel to acute inflammation. For example, diseases such as tuberculosis and rheumatoid arthritis. Chronic inflammation can also be caused by the inflammatory and biochemical inducers that are causing oxidative stress and mitochondrial dysfunction, such as increased production of free radical molecules, urate crystals, and others. Another difference lies in their symptoms, as acute inflammation may cause flushed skin at the site of the injury, pain or tenderness, swelling, and heat or warmth at infection site. How these symptoms develop and how long they last will depend on the cause, which part of the body they affect, and individual factors. Whereas, the signs of chronic inflammation may include abdominal pain, chest pain, fatigue, fever, joint pain or stiffness, mostly in rheumatoid arthritis, mouth sores, like an HIV infection, and skin rash, as in psoriasis. So these signs and symptoms of chronic inflammation depends on associated disease and site of problem. Another important difference is that during acute inflammation, innate immune cells form the first line of immune defense and regulate activation of adaptive immune responses. By contrast, during chronic inflammation, these roles can be reversed. Adaptive immune responses can cause ongoing and excessive activation of innate immune cells. Well, regardless of the underlying initiating cause, if an infectious or assaulting agent is inadequately cleared and persists in tissue, or a tissue is subjected to ongoing insult and damage that fails to heal in a timely manner. Host inflammatory responses can persist and exacerbate chronic tissue damage, which can cause primary organ dysfunction and systemic complications. So, this was about the types of inflammation and their main differences. We already have a detailed video on acute inflammation on sqadia.com. So, our sole focus here is chronic inflammation. Let's find out more about it in the next parts.